Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change.
Well, hi, everyone, and welcome to Alzheimer's Speaks. I'm your host, Lori LeBay, and I hope you're having a fabulous new year. Today, we're going to have a show that's kind of a sad topic, but it's one that's really necessary to talk about. It's about people living with dementia who are targets of social media abuse in nursing homes. And we have our special friend, Eilon Caspi, back with us, and I can't wait to have this conversation because, again, I think it's a really important topic, and we can't make change if we're not educated. But before I introduce you to him, I want to give a couple of shout-outs. One, I would invite all of you to be part of our new initiative, Be a Giver of Hope. And you can actually download graphics and join the movement, which is just about sharing information and resources, sharing your stories and so forth. So you can go to alzheimersspeaks.com, go to our free educational resources in the tools section, and you'll find out how you can download that. Or you can go to our sister company, Dementia Map, which is a great resource directory in and of itself, and find information there too. I do want to give a shout out to Twiddle. Twiddle is a great company making wonderful sensory aids for so many people who just need comfort, maybe a little anxiety, fidgety, maybe they are dealing with sundowning, all kinds of things. Or they also have what's called Adapter-Wrap, which is just a real convenient clothing, which is a shirt that secures in the back, and it's real easy if people have difficulty with mobility and things. And you can go to the number 4 twiddle.com, for twiddle.com for more information. I also want to give a shout out to the Senior Resource Network. Many of you might not know that Alzheimer's Speaks is part of that network, and you can still find us on all the regular podcasts, Apple and Spotify. And Eilon, I'm so excited to have you back on the show. First of all, we used to work together here in Minnesota, and I just miss you greatly. And I so appreciate staying in touch with you. And, you know, I see the work you're doing, and it's absolutely incredible. So today's topic, you know, we're going to be talking about people living with dementia and how they're targets of social media abuse in nursing homes. And so I want you to first introduce yourself to our audience, and then maybe explain that topic, because people might not understand the mix of social media, people in nursing homes. How does that even happen?
Thank you, Lori. I'm thrilled to be with you here today. I also miss you, and I miss your colleagues who are living with dementia on Dementia Chats, which I always, from the first day that I moved to Minnesota, I thought it's cutting edge. I know there's others who are doing it as well, but you really led the way to learn from the lived experience of people living with dementia. We professionals and researchers can all learn from them. So thank you for that. So Lori, I want to thank you for helping me raise awareness to this issue. I will explain what the issue is in a moment. But before I do so, I also want to recognize my good colleagues, Weilin Shea, who is a doctoral student, and Marianne Piju Liu, who is associate professor at Purdue University School of Nursing, for working with me on this project. So when we say, you know, the title of this conversation today is People Living with Dementia Are Targets of Social Media Abuse in Nursing Homes, and I should say also in assisted living residences. So what we mean by that is that these are situations where care staff members are taking demeaning photos and videos of residents, of older adults, including verbal, mental, physical, sexual, abusive acts, and then they go and post them on social media platforms such as Snapchat, Facebook, TikTok, Instagram, what used to be called Twitter, now X, FaceTime, and other platforms. There are at least three problems with these acts. One, obviously, these are violations of privacy protections, HIPAA privacy rules, and federal nursing home regulations and state regulations, because the photos and videos are taken without permission of the individual resident and or their family or legally authorized representative. The second issue is that these photos or videos are depicting humiliating and abusive acts on camera. And the third part, that the staff member is then taking it to another level and posts it on social media, which is another overlaid form of abuse. So I just thought that would be helpful to give a little bit of background before we kind of dive into the questions that we have for today.
That makes a lot of sense. I appreciate that. Can you tell people a little bit about your background too?
Oh, sure. So I am a gerontologist and an elder mistreatment researcher. I started working in the aging field 30 years ago, as of a few weeks ago, in a nursing home where my grandfather lived. I worked as a nurse aide. Since then, I worked as a social worker, educator, author, applied researcher, and care advocate in long-term care homes, with a lot of focus on people living with dementia. And I have a consulting company called Dementia Behavioral Consulting, where I help family members or even individuals with dementia in their journeys. And with regards to personal connection to dementia, both my grandmothers lived with dementia, and both of them lived in nursing homes.
Okay. Well, thank you. I appreciate that very much. That's nice to have that kind of background. We've talked about kind of your personal attachment to dementia. And in your background, we've talked about kind of defining the topic itself. But what led you to this topic? Did it just drop in your lap, or was it something that you've observed and heard from others?
Yeah. So in 2015 and 2016, ProPublica released a report with brief descriptions of 47 incidents in nursing homes with these privacy violations and inappropriate posting on social media and abusive incidents as well on social media. They used state investigation reports, court cases, and media reports, and NPR featured it in 2016. In response to this publicity, the American Healthcare Association stated that nursing home companies are all struggling with this issue. It was also recognized at the time that the issue is underreported, in part because many of the victims have dementia, a subgroup of whom may not be in a position to recall or report it. So I had it at the back of my mind. Then in recent years, every week, my colleagues at Elder Voice Advocates in Minnesota and I review completed investigation reports that are posted online by Minnesota Department of Health every Tuesday, including today. I noticed that an increase in these cases in recent years, not only in nursing homes, but again, also in assisted living residences, including those dedicated for people living with dementia. I don't like the term memory care for obvious reasons. So this, along with isolated media reports, kind of scattered across the country over the years, led me to decide to focus on this issue. Really, this is an emerging threat to older adults in long-term care homes, and I should add, in the community as well.
Wow. I don't think people really understand how this kind of stuff even happens. We all think that there's rules and regulations set up and in place to be able to handle this stuff. So, for you, how did you dig into this as far as, your sources for information? I mean, do you kind of got to go undercover, or are you looking at just things that have been reported to the states, or how does that work?
Yeah. So I gained access to 100 investigation reports from nursing homes in 31 states from what is called the Nursing Home Inspect ProPublica website. The investigations were completed between March 2017 and June 2024. Now, the ProPublica website draws completed state investigations from CMS Care Compare website. CMS, for those who don't know, is the Centers for Medicare and Medicaid Services. And that's this federal agency overseeing care in over 15,000 nursing homes nationwide. Now, the advantage of Nursing Home Inspect website over Care Compare is that it offers powerful search capabilities that Care Compare does not offer. And they recently substantially enhanced the search capabilities. I was one of the people they reached out to give them feedback into this improvement. So I was among the first people and researchers aware of the change when it occurred several months ago. This is like a treasure chamber waiting to be opened on all aspects of nursing home care, and whether it's infection control, quality of life, dignity, safety issues, different forms of abuse, etc. Very powerful. So, in addition, as I noted earlier, I've also gathered about a dozen investigations from MDH, the Minnesota Department of Health, that are posting it online weekly, both from nursing home and assisted living. To my knowledge, this is the largest data set on this issue. While I'll share some preliminary findings shortly, I wanted to share that with my colleagues at Purdue University, we are currently expanding it substantially to include a total of about 50 data elements to kind of zero in of different aspects of the circumstances surrounding these incidents, the nature of them, how they're being addressed or not addressed, and what is the harm for residents, what can be done about it to prevent it. Our goal is to generate insights for prevention and policy changes.
It's incredible. And it must be, as a researcher, really exciting to be able to see more accessibility in terms of, trying to really pull things together and connect the dots. That had to have been really frustrating, I would imagine, before, when you're like, well, what about this? And what about that?
Right. So I did a study on residents' fear of retaliation in 100 nursing homes, and I had to go before the change with ProPublica. They already had a one keyword search and not other filters for search. And I had to go through 800 investigation reports to narrow it down to 100, 800 one by one. Once they enhanced their search capabilities, I was able to do the social media to gain access to social media, 100 investigations in maybe 1/5 of the time.
Wow.
And when I shared the ProPublica Nursing Home Inspect website with a leading researcher on one aspect in long-term care, sexual resident incidents, and she's one of the pioneer researchers, Pam Tister. She's the chair of the Gerontology Department at Virginia Tech. I wanted to show it to her because I know she did the early studies on this issue, and she shared with me that back at the day she had to advocate just to gain access to APS reports, who are an external agency that investigates these issues in some states. They even had to advocate for a change of law to allow them access to the data. Here we have it at the tip of my fingers. I can access them right now without a problem. So it's a big step forward.
Wow, that transparency, we hear that word being tossed around a lot, and that transparency and accessibility, they've got to go hand in hand, and it's got to be user friendly. Because a lot of times they can say, oh, here it is. And then you're like, but how do I use it? And how do I access it?
Interesting, you mentioned that because I offered, and soon we're going to schedule with Chris Sandberg, the executive director of Elder Voice Advocates. We're going to do a shorter overview webinar on Nursing Home Inspect so that the public will be aware of it, media reporters will be aware of it, and researchers will be aware of it. So this is coming soon.
Oh, that's fantastic. Because a lot of times we design stuff and we make improvements, but then it stops and nobody knows, and it's like someone barked about it enough and they're like, okay, let's put this one to bed. But then it's not shared with all the people that need to have access and need this knowledge. I would see that all the time for people would apply for a grant and they would develop a product and they would be great products, but they would have no money for marketing. So nobody knew. And so then they would just like, oh, okay, this isn't working. And it wasn't that it wasn't working. It was like nobody knew that it was even available. And then they would apply for another grant, develop another product that no one would ever know about. And it was just this cycle over and over and over. And I just thought, what a waste of time and energy and money. And there's still all that frustration out there. So this is really, really exciting to see that change in
Yeah,
things.
I
So,
just wish that they had a similar data system in assisted living residences, where a lot of
mhm,
people with dementia live. Between 40 to 50% nationwide are estimated to have dementia in assisted living, and 7 out of 10 have some level of cognitive impairment.
mhm. Yeah. Oh, I can totally, totally believe that. Well, what were some of your preliminary findings?
Well, we've identified 152 victims of these acts, and about 85% of the victims had some level of cognitive impairment. At least 50 of them live with mid to late stages of dementia. And this is a clear underestimate, a conservative estimate, because there's a lot of lack of reporting of cognitive function levels in some of the investigations. So obviously, beyond the violations of privacy and dignity and trust,
Mhm,
right? We've identified many disturbing and appalling incidents. Some were very cruel to the older adults. Some are outright crimes. And I think we should consider adding a banner on this interview saying, some of the content you're going to hear about is very disturbing.
mhm,
Um, so And I'm going to give a few examples in a second. Now, the most common social media platform used to commit these acts was Snapchat. Related to it, some may wonder what Snapchat, which is largely used by people in young age groups, has to do with older adults. Well, there's a significant age overlap with the age of direct care staff in long-term care homes and the age group of Snapchat users.
mhm,
And many use social media platforms on a daily basis. Many are glued to the screen. We know there's addiction to screens in the society in general, and it's only seemed to be getting worse. So I wanted to share that some of the negative consequences that we're already seeing from preliminary data, this is not even the full analysis, is residents are reported to feel violated, embarrassed, they feel frustration, anxiety, anger, fear. They feel humiliated, dehumanized, depression, crying, inability to sleep, and withdrawal. So really across the board. So I want to give a few um, examples of real cases that happen. But before I do, I want to mention a very important concept because we're focusing heavily on people living with dementia. CMS as a term that is called reasonable person concept.
mhm,
So, and what does it mean? So reasonable person concept is a term that CMS, the federal agency that oversees nursing homes, provides guidance to surveyors all across the country that conduct those investigations in all states. And when the person who is harmed has advanced stages of dementia, um, the federal agency instructs the surveyors to apply this concept when they determine the level of harm caused to victims due to violation of federal nursing home laws and regulations. And what it means is, because the person may not be in a position to report to us their suffering and their harm, maybe they don't have a family to report how devastated they are. What it means is, what degree of actual or potential harm would one expect a reasonable person in a similar situation to suffer as a result of the non-compliance? So I just wanted to put it out there because there's a lot of dismissal of people with dementia. We're going to get to it in a minute. So here are some examples of things that happen. The first one is an incident. It happened in a nursing home in Kansas. A resident with severe impaired cognition and dementia was taunted with a baby doll. The perpetrator was a nurse aide, took a video on her cell phone of the nurse aide taunting the resident with a baby doll, making the resident try to grab it and bite the baby doll, running the doll in front of the person's face while the resident is trying to hit it and beat the doll. And this was a video. A second one is staff members pulled the wig of a resident with severe cognitive impairment and Alzheimer's disease in New York, and then hitting the resident with the wig on the resident's head and taking a video of it and then posting it to social media. A third incident in Oklahoma, a photo showing feces up and down the legs of a male resident with severe cognitive impairment and dementia. The perpetrator was a CNA. The photo showed the person from the chest to their knees. The feces was up and down their legs. And oftentimes, perpetrators add a caption to further humiliate the person. And on the photo, it says, "This is how my morning is," capital letters, "shitty," 3 exclamation points. "But for this extra $20 an hour, I get off early, so it's a win-win." A fourth incident occurred in Oklahoma, and a resident with severe cognitive impairment and dementia. 2 CNAs, one of them held down the person and gave them wet willies. If somebody doesn't know what wet willies are, is when you wet a finger with saliva and put it in a person's ears, and taunting the resident. She was told she could not lay down, so they held it down and they gave her those wet willies. The last example is occurred in Minnesota. It's actually a recent case that there was a TV segment about it. A resident with moderate impaired cognition with cerebral palsy, a male resident, was aggressively thrown into bed, and then the perpetrator took a shoe and threw it on the bare chest of the resident, and then hitting the residents in the face with one of the shoes. The resident was heard on the video saying, "Ouch." And the nurse aide proceeded to give the resident the middle finger. So I can give dozens of more examples of these appalling incidents. Some of them are criminal, obviously. So clearly, when you tie together, and that's the reason I think we're here today. There's a heightened vulnerability and risk for older adults living with dementia to this form of abuse. And so I'm extremely grateful for you giving me this stage to try and raise awareness to this issue and call for action to address it.
Well, I want to make a couple of comments on the examples you gave. So one you said was a nurse with the shoe and giving the finger. You know, a lot of times I think everyone thinks that this is just, you know, the direct care staff, the ones making the least amount of money that this would even happen with. But this can happen with all kinds of different employees within a community. And so we have to be aware of that. We have to take these things seriously. I still feel horrible. My dad died in 2001, and I still carry the guilt of not listening to him and honoring his voice when he told me staff were being very disrespectful and rude to him when he was showering. And he was in tears. And my dad had brain cancer. And at the end, we questioned a little bit about his reality, not a whole lot, but a little. And I asked who did it. And of course, they denied it. And then I asked other staff if they were aware, and they said no. And there was really a good care team that I just trusted implicitly. And at my dad's funeral, one of those staff said, "I am so sorry. Your dad was like my dad to me. I never had a father, and I loved him to death. But I was scared of these people. I was scared I was going to lose my job, and I was scared what they might do to him. But he told the truth."
Wow.
And
Wow.
I know. And
I'm
like
so
you said,
sorry, Lori. It's just horrible. So many families carrying so much guilt and trauma, and it's not addressed.
yeah. And I felt horrible for her. She was a doll, and yet I understand she was afraid for herself. She was afraid for her job. She needed that income. And she was afraid for my dad. If she reported it, what else would they do to him?
Yeah. Yeah. Lori, I want to tell you that after I'm going to complete this and another project, my hope is to get funding to do what is called the guilt study, because now I know enough families who had their loved one mistreated, dehumanized, demeaned, abused, neglected, financially exploited, and the guilt that they carry. And from the short literature review that I didn't see a single study to delve into what does it mean to have guilt and how do we address this. We can't just forget about all those family members who were carrying those. You're talking about 23 years ago.
Yeah.
This guilt with them. So how can we understand the guilt experience and what can we do about it?
Yep. Well, and even recently, this wasn't in a nursing home, but it was in a hospital setting. Had a relative admitted who has dementia, undiagnosed but very obvious, who has type 1 diabetes. And she was in there for aggression, which was very unusual. And they said nothing was wrong with her. They held her for 24 hours and gave her no food and no insulin and released her to us with numbers through the roof, both for her blood pressure and her insulin. It took us 2 days to get her leveled off.
Oh, wow.
And I still haven't had a chance to file a complaint because I'm dealing with 2 relatives with hospitalizations and all the outcome. But I will be filing a report and calling them because I just couldn't believe they did that. And I know that they're all overwhelmed right now with, the flu and the RSV and the COVID, and the emergency rooms are packed, but it's like, we could have run in the insulin. We would have brought food if that was what was necessary.
It's interesting you mentioned that. I'm sorry to hear this incident. But, years ago, a professor of mine, Nina Silverstein at UMass Boston Gerontology program, she retired recently. She wrote a book with Katie Maslow, Improving Hospital Care for People with Dementia. I have it in the back there. And one of the things that kind of caught my attention in the book, because they reviewed the research and the practices and what can be done and innovative models of acute hospital care for people with dementia. I even visited the one in Manhattan because of that book. That acute care setting that does not longer exist, unfortunately. But what I wanted to say is that one of the facts that they shared in the book is that a lot of people with dementia, and it won't surprise you, that a lot of people with dementia who go to the hospital return in a worse condition than they went in.
Yep.
And we know what horrors a person with dementia can go if they don't go with a trusted, caring person who knows them well, and what can happen to them, chemical restraint, physical restraint, the trauma that can go on there. But in any case, yeah.
Yeah, it happens. And, but, part of it is people need to talk about this stuff too. And, I carry some guilt that I haven't filed that complaint yet, but I have my hands full trying to maintain the home setting. But I have not forgotten, and I will not forget this round on that, because
Yeah.
that was, you go there to be cared for, and like you said, came home worse than what you went in. That's not acceptable.
Right. Unfortunately, a lot of investigations are delayed for different reasons.
Mm-hmm.
And so the more delayed the investigation, the less evidence could be collected, because there's such a
Mm-hmm.
turnover in all healthcare, let
Mm-hmm.
alone assisted living nursing homes. So by the time you come, the resident, if it's a long-term care home or declined, the roommate who witnessed it is passed away or moved to a nursing home, and half the staff are turning over every single year, or I think yeah, roughly that amount of turnover. So, timing is of the essence with these investigations.
Yeah, for sure. For sure.
Okay.
Well, I want to just take a quick break here before we finish our conversation, because I've got some more questions for you. And I always enjoy talking with you so much. And I want to make sure that people have your contact information, which of course we'll give at the end. But they can email you, and the spelling is EILON, and then last name is CASPI@gmail.com. And then you can go to his website, dementiabehaviorconsulting.com. And then you also have an article that we'll post in our blog, and then also in the show notes, that you did for McKnight Long-Term Care News, which was what nursing homes can do to prevent staff misuse of social media, which I think will be really exciting for people to be able to have. And then before I pull Eilon back in, I always like to give a shout out to my webmaster, who is Q for Good. They are absolutely incredible. And in all the years I've had websites, I've never had an easier, more respectful, good communication, talks at my level type deal, and just good heart, great follow through. Q for Good. And, if you mention my name, you can get 10% off, but they are, I just can't say enough good things about them. And if you're looking, I really encourage you to check them out. And it's just qforgood.com. And we'll have that contact information in there for you, as well as the company called Twiddle that has great sensory tools, which we'd love to see in more, hospitals, assisted living, all of those types of things, to kind of help calm our dementia folks down when they're sundowning or anxious. And they have a variety of sensory tools for that. They also have a product called Adapter Wrap, which is wonderful if you have anyone who has mobility issues or maybe disrobes, because everything, closes in the back, and yet it's soft. And especially here in Minnesota, we're freezing here right now. And it's nice fleece lined material, but you can go to the number 4 and then twiddle.com for more information. And if you use the code AS25, you can get a 25% discount on them too. So I just, it's always fun to pass along good resources that you find. I find it helpful anyway. So I hope you, as my audience, does as well. So let's get back to our line of questions here. What are some of the things, we had mentioned that you wrote this article about, what nursing homes can do to help their staff, but what are some of the things that nursing homes can do to prevent some of these incidents that are occurring and protect the residents? I know some say, well, you can't use your phones, and you can't have your social media, but that's kind of a double-edged sword. in my eyes in some ways too. So let's talk about what you think can be done, but I'd love to talk about the phone scenario in the workplace as well.
Yeah. So I'd love to learn more about what you see as the downside when we get to it, to kind of enrich this conversation. I know I'm learning about this issue as well. So as you mentioned, thank you, Lori, for kind of mentioning the McKnight's Long-Term Care News blog post that was recently published with 10 things that nursing homes and assisted living can do to address this issue. So the first thing is zero tolerance. So we need to set expectations prior to the first day of employment, including being very clear about consequences for staff members who are engaging in these acts, perpetrators. We need to raise awareness of director staff. Non-director staff could be a housekeeping person, could be maintenance, could be dietary, kitchen, it could be front desk, could be visitors, private companions, volunteers, family members, residents themselves taking photos. It's happening too. So we need to raise awareness. That's number one. Education, education, education. We need to do sensitivity training specifically on this issue. We need to develop a code of conduct. We need awareness of consequences for victims. So the people who work in care homes need to be fully aware of the potential consequences for not only for themselves if they engage in those acts, but also for victims, how harmful it can be, as we alluded to earlier. They must develop policies and procedures related to smartphones and other camera-equipped devices. Yes, employees should have protected rights and their right to use a phone or social media. However, it used to be, I used to started in a nursing home world as a nurse aide 30 years ago, and we had to put our phones in a locker. And guess what? It worked like a charm because we were only allowed to use it in breaks or meal breaks, and even then, only in the staff room. Now you have, and this is not just for the United States, I have colleagues in other countries telling me that residents are falling and breaking hips because staff are on the phone while giving showers. So we have a problem here. So we need to also make sure that the policies and procedures, but that being said, staff also have rights to use a phone and to use social media and for self-expression and for supporting each other and for sharing useful resources. But how do we strike a balance? How do you make sure that that phone doesn't make it into the bathroom or the resident's bedroom unless it's a designated phone for charting of clinical issues, right? So we need to strike a balance. We need to use common sense here. And so also we need policies and procedures related to not taking photos and videos of residents without their permission, or if we're talking about advanced dementia, from their families or legally authorized representatives, and definitely not posting those on social media platforms. We need to make sure that long-term care homes immediately and thoroughly, this is words from the federal nursing regulations, conduct investigations immediately and thoroughly, and that their reporting requirements are known and followed, including for mandatory reporters. And I want to go back to the issue of staff education. There's several misconceptions about social media in nursing homes and assisted living residences. I'll give you a few examples. So one staff member said, I set it to automatically disappear on Snapchat. When the receiver of the video can take a screenshot or record it, and then it has a life of its own. Even if it's deleted, it can still live on the server and may be discoverable in court of law. Another example, one staffer took a photo of a resident's legs with feces on it. And the perpetrator said it was just her legs. You can't recognize the resident. But guess what? The victim's brother identified the rainbow Crocs on his sister's feet. He immediately identified her. He was very, very upset by it. We were just having some fun. The residents enjoyed it. Or holding a Christmas party outdoors. Well, it's still a violation of privacy if no permission was given to take and post the photo or the video. Sometimes they post on Facebook and the public finds it and become alarmed. This is private health information, and I'm going to get to an example of that in a second. Um, One perpetrator said, I did it. They asked the perpetrator, why did you do it? And they said, to vent. Well, this is obviously an inappropriate way to vent whatever you as a care staff member is going through. Or he was asleep, so he was not aware of it. Well, it is still a violation. And when he learned about it, the resident became upset about it. The last one, and related to the population we're focusing on today, she has dementia. She doesn't understand and won't remember anyway. Well, remember the reasonable person concept? When her family discovered it, they were outraged. Other things to consider is ombudsman education and involvement, and with residents' permission only intervention. Police needs to become aware, law enforcement awareness and investigations. We need to prosecute perpetrators when it kind of reaches the point of gross abuse and crimes. And we need to apply the criminal background checks to avoid hiring the individuals in other care settings. We know the phenomena of perpetrators being fired by crossing the street and starting to work in another care home. So we need to make sure the nurse aide registries with the names of these individuals are robust and timely and meaningful disciplinary action, and in some cases, prohibition of working with vulnerable adults in healthcare systems. There's also lawsuits. And so in one case, a 91-year-old Margaret Collins, who lived with dementia in a nursing home in Illinois, was taunted with a nightgown. There's a TV segment about it. She appeared in distress as she was trying to push away the gown. The aides videotaped it and added a caption, "Margaret hates gowns," with 2 laughing emojis, and posted it on Snapchat. The family was outraged. Her daughter, Joan, said, this is somebody's sick idea of entertainment. The family has taken legal action. They filed a lawsuit seeking more than $1 million in damages. They alleged that the nursing home turned a blind eye, despite knowing about the video. The family said that the perpetrators remained on the job for weeks after initially being cleared by administrators, when we know that by federal nursing regulation, they must be immediately suspended pending the outcome of the investigation. So I'm going to pause here before we're going to go into the policy implications in case you have some thoughts, comments, questions about that part.
You know me, I always do. So one was you had talked about a registry for nurses and aides. I would actually like to see that expanded to anyone working in those situations. So admin, dietary, maintenance, housekeeping, because there's a lot of that happens too, and also including home health care agencies that come in and serve as well. And
absolutely, I think it's a great idea. Home care, we know vast majority of people with dementia live in the community, not in long-term care homes.
Yep. And so that would be really, really interesting, I think, to see. And then the other was, I'm going to give another example of how I think things fell through the cracks. So I have a friend who currently lives in a memory care. And when he goes outside of his room into the community setting, a couple of times this has happened to him. A woman approaches him very aggressively, says she's with the FBI and investigating him. Now, he doesn't know who that person is. He just knows it's very intimidating and it's very upsetting to him. And so he took a picture of her. And then he was scolded that you can't take a picture of her. But nothing was ever addressed as to his feelings or what was going on with the situation. And I'm like, well, that was a big crack. That doesn't help either side with much of anything, and just added to his irritation and his lack of feeling safe in the community, right. That. And so and I was not there, and I don't know who this person is. I'm assuming it's another resident, but don't really know that for sure. I would think it is, but goofier things have happened.
What was the care setting again? Sorry.
It's a memory care. It's a memory care.
In assisted living?
It's in an assisted living. Yep.
And that was a person who lives in that setting or an
Yep,
employee?
that's a person who lives in the setting. Yep, and is diagnosed with dementia in that. And I know in that setting they have some people who don't have dementia, but who might have Parkinson's or something that just can't live alone. So they've kind of got a mixture in that setting. But it was just like, well, that's not right. And again, I don't know if it was a relative or a friend of the person who was saying that you can't take a picture, but nothing ever got to the staff, and then he goes into his room scared, and then he forgets about it to report it
Right.
and say
So
anything.
here's a couple of things. First of all, here in Connecticut, where we live now, the ombudsman and other stakeholders were able to pass a law during the pandemic that residents have a right to use any technology. Residents in
Mm-hmm.
long-term care have a right to use any technology of their choosing in their bedroom. Remember, the
Mm-hmm.
bedroom is their not only it's their home, it's their
Mm-hmm.
last frontier of privacy. So if this is their home, then, but again,
Mm-hmm.
you have to respect a roommate, you have to respect others' dignity, and there's bathroom issues, and we want to be
Yep.
respectful. So that's one thing. The other thing I want to say, it's interesting you bring it up because there was an incident that was actually reported in the media. I forget which state, where a resident was in a long-term care home was alleged that he was neglected on an ongoing
Mm-hmm.
basis by staff members. He told the staff members, if you continue to do it, you're going to
Mm-hmm.
be in the public domain.
Mm-hmm.
He opened a TikTok channel and he recorded them and he put it on TikTok for everybody to see how he's being neglected. So things are changing, and it's a delicate, sensitive issue because where there's balance between your rights for dignity and safety, and then your rights and others' rights for privacy. So how
Mm-hmm.
do you balance this in a rapidly evolving environment with all those screens and all those devices, not just smartphones, but everything under the sun? So, and regulations often lag behind and don't catch up. So that's a big challenge. And we have residents going on the weekend and posting online on social media. Look, there's no staff here. So on one hand, they're trying to express their frustration that nobody is watching them over the weekend, no staff members. On the other hand, they're taking photos of other residents. A very complicated issue.
Yeah, and I will add in when I had made the comment of the pros and cons of staff having phones and things, is what I find when the phones are taken away. I can understand it's a protection for residents and for everyone, but it also loses those moments of joy to be able to be captured and shared with families and to be documented. And to me, that is massively important because in our society, especially with dementia, where we have been trained that there are no moments of joy, this is
Right.
just a terrible, horrible disease. We're pushing that away.
Right,
And
right. Yeah, but I wonder if there's a way to strike a balance. For example, a designated, and during the pandemic, a lot of, I don't like the word recreation
Mhm.
department received iPads.
Mhm.
And so I wonder if there could be a designated and also secure, because this is private health information now on it. And how do you navigate the informed consent landscape in general? Hard to
Mhm.
do, and with the gray areas of mid-stage dementia, not a simple thing to do. But maybe we can be proactive and have a designated 2 or 3 devices that could be used to capture
Mhm.
those moments in a proactive, and maybe it's coordinated by the director of recreation therapies, or being mindful about it as opposed to the random, oh, I just pulled it out and I took a photo, but guess what? There's no permission. You just violated the person's privacy.
Well, to me, I think one of the problems comes down into how we train. We train by slapping hands. We really don't train by promoting healthy relationships. And so when we're telling them everything they can't do, we all know there's rule breakers going, yeah, go ahead and tell me I can't do it. That's going to motivate them even more. But if they walk in the door going, this is important, this is who we are at our core, we are about relationships, connections, moments of joy. Now we've given them a healthy way to utilize that. and frame it in a different way. And to me, if we build that up, it will be more evident of these are wrong ways to use it.
Yeah. So I'm so glad you brought it up because we both know Judy Berry and we
Mm-hmm.
also know how visionary she is. And she founded Lakeview Ranch model of specialized dementia care. I mean, it's two care homes that won Robert Wood Johnson Foundation award for the innovative care for people who were considered aggressive. And she demonstrated otherwise with a humane, dignified approach and reduce hospitalizations and behaviors substantially. It was reported in journal articles and others and other outlets. But what I wanted to say about Judy is that she she had the ability with her partner to the vision, first of all, to seek informed consent prior to the admission of the first person,
Yeah.
and they got informed consent, and they had many films of joyful moments that they exactly to your point, but they were very intentional about it. They
Mm-hmm.
sat with families, they explained why they want to do it, and then they did it, and residents gave consent if they could, if not, the family gave, and it created a trove of a treasure chamber of pearls of joy in the moment and the can do. Look what we can do with people living with dementia. So absolutely. So how do we strike a balance, right?
Yeah. Yeah. I think that it's really important. We get so regulated so heavily that it takes all the fun out of doing the job. It takes away the ability to think that there's joy and that even though maybe a person can't talk or say full sentences, there are so many other ways that we communicate, and start from that crux of this is how we are still going to have relationships and
Right,
teach
right,
them
yeah,
that multi-sensory stuff. But I don't want to get us too sidetracked, but that
right.
was my point of if we take away, the phones, I get there's a protection, but there's a big loss too in
Mm.
terms of teaching moments, capturing memories, and then sharing them with not only residents, but family, because that can reduce their anxiety, that can build trust. And there's so many positive factors from that.
Good observation. Yes, good point. It's a
So
delicate balance, right? Yeah.
it really is. Gosh, what do you think and what do you see in terms of policy implications right now for your project? Do you think it's going to move the needle, the needle, or has it already? Do you think?
So there's a series of things we need to do. We need to, yes, we don't want to inhibit innovation, but we also need minimum standards
Mm-hmm.
anchored in regulation, because otherwise it's Wild West, and we're seeing it in assisted living, dementia care, and trust me, I'm seeing it every day, including today. A resident that was posted that the resident choked to death due to neglect. So we also need minimum standards. So we need stronger, I do believe that we need stronger CMS and state survey agency oversight and enforcement of this particular issue. CMS does have a memo that they put out to all surveyors across the country in 2016, but it needs to be updated now that we have more insights into this issue. We need to educate state surveyors and ombudsman representatives across the country about this issue. We must hold social media companies accountable, such as Snapchat, Facebook, and others. And we need to pass federal and state laws requiring social media companies to have strong safeguards, whether it's timely detection, prompt content removal, sophisticated AI algorithms for early detection, referrals to law enforcement. We need those safeguards in place when it comes to protecting older adults. Snapchat, for example, in their safety guidelines that I reviewed, have heavy focus on protecting children, teens, students, young adults users on the platform. They have safety centers, parent centers, educational initiatives for educators and school administrators, but not a single word related to protecting older adults, not a single word. So I recently met with Rachel, who is the head of safety at Snapchat, and their legal counsel, Becca, and gave them a 45-minute presentation with a exclusive focus on these violations on their Snapchat platform. Rachel said at the end, a lot of the content that I shared was deeply disturbing, she said. I quote her. I urged them to take action to protect older adults and even suggested a collaboration with a quality improvement project with our data. I also wrote a letter to Evan Spiegel, who is the co-founder and CEO of Snap. I'm waiting to hear back. Now, Congress has taken notice when it comes to protecting children online, such as from sexual predators and other criminals online. Senator Richard Blumenthal is spearheading a proposal for federal laws such as the Kids Online Safety Act. The last I heard about it was December 15 last year. So I'm not sure how this proposal unfolds, whether it's approved or about to be approved or not. My question to the community is the serious harm caused to older adults and those living with dementia is even on Congress radar screen? And we know that the ProPublica reports I mentioned at the outset were published in 2015, 2016, recording the first incident in 2012. So this is an issue that goes on for over 12 years. So I want to pause here, but I do want to get into next steps of what my team is planning to do next, unless you have comments or questions at this point.
Of course, I have a comment. So
Please.
I don't think our lawmakers have a clue on this. They are getting pounded constantly for funding for research for drugs. They are not being, I don't think, educated in terms of the realities of everyday life. They are, it's just about a cure to reduce the budget, cure to reduce the budget, cure to reduce the budget. And it's not about quality of life as we go on. And so there has been, millions, probably billions of dollars put towards a cure that we're not even close to seeing, in my opinion, with all of this. And, if we can educate people, if we can get people back to being kind and professional and interactive and hopeful, that's a huge difference. And so much of this isn't talked about because families are embarrassed about it. So I'm so happy that you talked with them. I worry greatly now with Zuckerberg coming out going, we're not going to cover anything about disinformation. Everyone's got the right to do, excuse my language, bottom line, whatever the hell they want to. And it was like, oh man, this can go from really bad to really so much worse.
Right. Yeah.
And that is very scary.
Yeah, we're entering a concerning period in a few days. So I wanted to take what you said now and I can't help but say that the majority of people living in nursing homes have a diagnosis of dementia.
Mm-hmm.
We mentioned that 40 to 50% of people in assisted living, where roughly 1 million people live, have dementia. So my question is, can we have, and we know that people with dementia are at higher risk of abuse and neglect and financial exploitation. So I am asking the U.S. Alzheimer's Association to hopefully listen and to join forces and to take the lead on addressing the various forms of mistreatment of the very population that they're serving. They have the power to do it. AARP too. And I have yet to see meaningful action beyond the person-directed care, practices that they put out. I would like to see them tackling mistreatment of older adults with dementia directly with their powerful lobby to keep people safe first. And so, and talk about dignity and talk about thriving that you mentioned earlier. So that's my call to the U.S. Alzheimer's Association. Hopefully they will reach back and we can start working on some issues together.
That would be wonderful. I know they were involved with the research that went into developing the GUIDE program that is, out to help people, live better pretty much at home. But again, some of those homes are assisted living. Some of them can be memory care, if it's not skilled care. And yet so many people don't know about that setting. And this is a great opportunity to be able to roll something like that into this program, because the Dementia Guide, my understanding is so that they can have a better life. Well, getting rid of abuse is a much better life.
Well, when you're being abused, obviously your quality of life and quality of care, when you're being neglected, your
Mm-hmm.
quality of life and quality of care is reduced, your dignity as a human being and the trust. So we need a fundamental shift in the U.S.
Mm-hmm.
Alzheimer's Association focus on those issues. They have the resources to do it. They have the political ability to also do very, very meaningful systemic changes on these issues.
Mm-hmm. I agree. Yeah, they have the list of whose ear to bend, and how the systems work, and things. And, everybody wants a cure, but, we need to do a lot of other things we have to care in between the cure.
Absolutely.
And even once we get a cure, we still should be caring, and we should be caring well, and being advocates of all their needs, not just nitpicking which ones seem to be convenient or which ones we might make more money from. And,
Right. And you and I, Lori, know that when you provide proactive, dignified care, when you fill those 7 buckets or so that Dr. Alan Power talked about in his model of well-being that was developed with the Eden Alternative earlier on in his book, Dementia Beyond Disease, focusing on the well-being proactively, people will thrive. And when they thrive, they live longer and more meaningful and purposeful lives. And then you're going to extend their lives. We're talking about delaying onset. We're talking about delaying disease progression. Well, here you have something that is the low tech, where it's so easy to go after the high tech that is sexy and it's, the silver bullet. But what about the common sense low tech that is right at our fingertips?
Yeah, and not only does it provide a better quality of life for the residents, but it provides a better quality work environment for the staff, which means less turnover, which means saving costs, it's just this stuff rollerballs if we can get it off the ground to work with. I remember this was years ago for one of the leading age. It was a 14-course program, and it was just very short. We did it two staff meetings every 2 weeks. And then we did one for the family every week or every 2 weeks. And they were all on the same thing, but it was about getting everybody on the same plate. It was about finding joy, understanding emotions, realizing, our multisensory connections. And I remember one company saying, we're not going to be involved with that. That's just foo-foo-y and blah, blah, blah. And one of the other parties that was with this company, their sister company, participated. And one of their administrative staff just broke down. And she said, I have never allowed myself to feel these feelings before. And that's a huge mistake. That's a huge, huge mistake. When we are dealing with people, to deny them feeling the feelings. And she kind of got pushed into it. She didn't want to attend, but she said, oh my gosh, this really opened up the door to help me reframe things and to feel hopeful and to look at new ways to approach things. And to me, it's all about that culture change of, it doesn't have to cost a lot of money. It can be really simple things like just not walking down the phone with your phone or your iPad in hand and actually making eye contact with somebody and saying hello. It doesn't have to be a 20-minute conversation, but those things have a ripple effect. And when you get people understanding their connections and not just scolding people, but reinforcing the good things that they're doing and making them, answer the question like, okay, for a week, that's what you did. You left you didn't have your phone on and you engaged with everybody in the hallway. How did that make you feel? And then you ask them, how do you think it made the other person feel?
Mm-hmm.
And then did other people notice a difference? And they all go, oh, yeah, they were asking me about that. And then they started doing it over nothing that had to cost any money, a little bit of training, a little bit of giving hope and opening doors and getting people to understand the impact that we have on one another.
Right, right.
It's huge.
Yeah, I don't want to open a Pandora box, but there's also a reality of a severe workforce crisis.
Oh, yeah.
So on one hand, we talk culture change and we talk, there's a lot of good practices out there, innovative models. On the other hand, there's a reality. There's a reality on the ground, and it's bad. And in many nursing home and assisted living, there's shortage of staff. There's huge turnover of daycare staff, nurses, administrators. So the system is very unstable. There's float staff, agency staff, traveling staff, and nurses. System is very unstable. It's the last thing that people with dementia need. So when we come to implement those things, we need to factor in the reality of feasibility, what is realistic, and how do we reform that system in a meaningful way. But I don't want to open a whole can of worms now, but I wanted to mention it at least.
Oh, no, that's real important. I did a program on recalibrating our care culture and really stepping back of how did we get here? Nobody talks about how we got here. And that's critical to be able to look at and really analyze the micromanaging and all of the things that we have done to ourselves as a culture. And we've stripped out the care of the caring business, and it's had a huge impact. So I know we need to get wrapping up here. Any other next steps or comments that you want to make?
Yes, thank you. So we're building an extensive data set with about 50 data elements to generate in-depth understanding of the circumstances surrounding these incidents to inform prevention and policy change. We're hoping to conduct a research study with my colleagues at Purdue University, Marianne and Eilon. Awesome collaborators. And we're thinking one possibility is a quality improvement project, separately related or with companies such as Snapchat. They have the resources to pull that off. I know it because I know how much money they make, and this is very small amounts to be proactive here. We want to apply for a research grant. We need $100K to do a full study, the first on this form of abuse in long-term care homes in America. I have yet to see a single study on this issue published in a journal article. We want to publish a report and work closely with media to disseminate it to the public. We want to do podcasts, webinars, conference presentations. And last, I'm working with a colleague who is using AI to generate images from a sample of those incidents. In fact, those 5 that I shared with you today, because a picture is worth 1,000 words. And so we want to incorporate that into our reporting, into our presentations, into our journal articles, to actually bring people into that moment where a staff member is doing those things, hitting a resident with a wig, or demeaning them in certain ways. So to kind of bring it to life a little bit, so maybe it will echo emotionally with people more, and maybe it will help move things along in terms of how do we work collectively to address this issue.
Well, I love that, because I personally don't think we make active, sustainable change until we feel it in a heart level. And, we can do all the logic and all the numbers, but that's really easy to kind of slide away. But once we feel it in the heart, it never goes away. It's always there, and it can be reactivated like that.
Yes, so in 1992, Professor Stephen Miles published an article it was actually in Minnesota. It was a collaboration with the Minnesota Department of Health and the Star Tribune. And meaning they used investigations from the Minnesota Department of Health, and it was he as a faculty at University of Minnesota, and then it was Star Tribune reporters. And what they did, they analyzed investigation reports, and they published the first study in the United States on physical restraints that led to deaths And many of them had dementia. Many of the individuals had dementia, mostly in nursing homes. And what they did in their journal article that they published, they worked with illustrators to illustrate what were the most common scenarios that people got caught in their bed rails and the positioning, or they were tied in a certain way and they tried to get out and they got choked. So that was very powerful. I still refer to it. The visual is very, very impactful beyond text.
Yeah. Well, gosh, I can't thank you enough for taking this topic up and, finding the funds to even do the study. And then, what I love so much about you is your heart is in this and you can feel it. It's not just a project to you. It's way, way more than just a job. And, you're out to change the world, to make it a better place. And that's huge.
You're speaking, Lori. You're speaking. Yeah, I mean, always I enjoy working with you. I love the stuff that you develop, the platform, the dementia chats, the radio programs. You're so cutting edge, way ahead of most out there. You've seen things ahead of time. I know you also, people also, not always or fully, appreciative, to say the least, early on, but you push through. And I hope you'll continue to push the envelopes and open the eyes of people who do care about people living with dementia. And I love it that you connect with the lived experience of people with dementia, because as you always say, they are the best teachers, and you truly listen, and not many do. It's the professionals who are coming in and say, we know better, or the researchers know better. And it's even sometimes family members don't even know. We hear from several of your colleagues with dementia. They're telling us that even their family members sometimes have a hard time to truly understand what it means to live with a cognitive disability. So you are leading the way, and I'm just so grateful that I met you so many years ago in Minnesota.
Well, thank you. Well, again, I don't think we can make sustainable change if we're not inclusive of everybody. We might not agree with what somebody says, but their perspective is important. And it's part of the picture, and we all have different needs. Every, community, family, individual, we all have different resources. And so, we have to find a way to meet in the middle and push forward and make this world a better place. And it's easily done when people get rid of the borders of I'm right and you're wrong, and just say, let's have a conversation. This isn't about a right or wrong. It's about improving and making the world better for everyone.
Yes.
To me, that's
Lori,
really simple.
Yeah, Lori, one of the things that I always at awe, and you inspire me, and I would never be able to get to that level, is that I remember a lot of conversations with people with dementia that we very, very emotionally charged, difficult conversation about excruciating things they're going through, and how you navigate it. How do you do it so respectfully and professionally? And it's just amazing how you lift people up. And I'm always at awe, and I will always remember that. And you put people at ease. It's always informal, and they speak from the heart. Excruciating thing. We have some people who went through extremely difficult things, and you're just present and grounded and centered for them. You contain, you affirm, you acknowledge, you even bring the humor, and it uplifts them, and that's why they come back. So I thank you for that gift that you have.
Well, again, I think it gets back to, if we don't know the true problems, we can't fix it. So we have to make comfortable environments. We have to, have a place where people feel safe. I mean, yeah, I laugh with them, but I cry with them too. I feel the pain, and yet I am so honored when they share their stories. I mean, for people to share some of the intimate things that they've shared with us and allowed that to be public, knowing that it's not going to change if we don't have these conversations. And so again, the power behind the work you're doing, because this is a very uncomfortable conversation for people at all different levels. And yet we have to have it if we're going to change. So thank you so much for your time with us today. I really, truly appreciate it. And
Same here, Lori. Thank you for giving a stage and a voice for people with dementia who are harmed due to these actions, and whose voice, more likely than not, in most cases, will not be heard.
yeah.
So you're doing a great service to them. So I appreciate that.
Well, and maybe the next research project will be about what is working and what are the moments of joy so that that can be spread around as well, because that is extremely important. Again, all of his information will be in our show notes, and reach out to him if you want to help fund a research project, or maybe you have an idea for a research product or contacts to get something like that off the ground, or lawmakers or social media moguls.
Yes.
We can all work together to speed this process up, or we can work apart and slow it all down.
Yeah, and Lori, let me wish you a wonderful year, good health, many moments of joy with your family, and for our listeners, our viewers, wish you all a good year of caring and support, and everybody can do their part, their little part, and together collectively, maybe we can move things forward for people living with dementia.
Great. So, in wrapping up, I would encourage you to check out alzheimersspeaks.com. Be a giver of hope. We now have a graphic that you can download if you're an individual or if you're a corporation to join the movement with Alzheimer's Speaks and Dementia Map. Again, all it is about sharing information, sharing your story, having conversations. It's very simple, doesn't cost any money, but it just opens the door for magic to happen. So thanks, everyone. We will catch you soon. Bye-bye. Thanks again.
Goodbye.
Are you a senior looking for unbeatable benefits? Join AMAC today and enjoy discounts on insurance, travel, restaurants, and retail. Plus, get 6 issues of our award-winning AMAC magazine packed with trusted news and insights. AMAC stands strong in defending America's future, bringing the voices of over 2 million members to our elected officials. For a limited time, get a 1-year membership for just $1. Don't miss out. Join now at amac.us/join now. That's amac.us/join now.